In terms of the application of your company's software in the healthcare system, as you mentioned, that you could use these surgical guides to guide physicians while they're in the process of actually doing the surgical operation. um, I want to bring the patient into question. So currently the industry standard in terms of why your company stands out from the others is the role of the patient. Like specifically in traditional healthcare systems, it's all surrounded around the patient, right, or the population at question. And in the past, it's always been like the physician is in a state of authority from an expertise sense, and so since the physician, I guess, knows best, it's generally been that the patient has sort of been out of touch with the whole process of knowing what's exactly going on with their surgical procedure, stuff like that. Where does the patient come in with regards to this new solution? Because
and it will depend of the surgery that it will get. In terms, for example, of orthodontic surgeons, or orthodontic is when the maxillofacial bite is corrected. The communicates really early in the process with the patient, and you organize like different expectations. But in terms, for example, in trauma or in oncology, the most important thing is to save the life and to return the quality of life for the patient. So the patient is involved, in my experience, most at the end of the planning or the surgical planning, because the patient plays a role to listen. Okay, this is the surgery that you are going to receive. This is the procedure that we are going to do. This is the final result that we are expecting to have after your surgery. So the patient plays a role at the final stage. And in our experience, we see that it is really important for the making decision process. I'm going with this surgery or not. So it's important because sometimes the patients get really afraid of the situation. They don't understand what's happening. They don't understand if it's secure or not. And if the surgeon shows the patient, okay, this is the procedure, we have planned this, we have these options, we have everything ready with like a plan B, plan C, with everything really organized, it is security for everyone, not only for the patient, but also for the surgeon who feels and knows that everything can be reproduced from the computer or from the digital planning to the OR.
Mhm.
Yeah, and I wanted to talk more about the future of 3D surgical tools. Where do you see this going?
Okay, this is moving really fast to the virtual reality. So, and also the robotic things. So there are a couple of procedures that are becoming or doing only for robots and not for like a human surgeon. So I think that everything is moving really fast to that point. And also the simulators. For the surgeons trainings, because most of the time they receive some really strange cases that they were not able to practice when they were studying, or it is the first time with that pathology in that hospital. So they are able to train themselves using 3D anatomical models, or they are able to plan all the procedure virtually. So it's something that will help them to have the security and to perform the surgery. So they are moving to the digital part. It's a step that they are doing mostly in maxillofacial departments, then in oncologies and orthopedics, but more in this surgeons are also getting more and more in touch with this kind of surgical planning.